Ever since longevity expert Dr. Peter Attia appeared on the Epstein list, or his emails between Epstein were exposed, I noticed a lot of YouTubers or podcasters on social media trying to expose, quote unquote, expose him. And many of these, they're making critical mistake that if they overcome that, it would become a lot more persuasive. And I wanted to make this video. I usually don't make these kind of YouTube videos in English, but I wanted to help some of these YouTubers out, so I decided to create this. And I call it Tips on Exposing Dr. Peter Tia Post-Epstein Files. And why am I qualified to do this? I've been listening and studying Dr. Peter Tia's work for many years, and I don't just listen to his podcast. Rather, I read all the show notes, and also all the research paper that he brings in. I read it and I dissect it. So you might get a little bit out of this. I hope I could help you fine tune how you expose Dr. Peter Tia. So here we go. The issue that I see, the mistake that a lot of YouTubers make, is that it's completely fair to fair. I'm not saying it's smart, but I think it's fair to criticize Dr. Peter Tia for maintaining a relationship with Epstein, and some of those emails look really childish, and totally go after that is, I think it's fair. However, the key mistake that a lot of you make is transitioning that to criticizing his recommendations or his advice or his takes on what you can do to increase your longevity. And here's an example of one. Let's listen to one.
Try their hardest.
We don't have a single metric of humans that we can measure that better predicts how long they will live than how high their VO2 max is.
The most important part of that is that it loses sight of the breadth of how your training should be designed for longevity. There was a study last year that showed that gymnasts and pole vaulters have 8 years on the general population for lifespan.
All right, so that's one of them. Criticizing Dr. Peter's claim that looking at VO2 max is one of the best indicators for how you're doing well now in order to live last 10, 20 years of your life in good health. Attacking him on those VO2 max studies, you better have also spent as much time as Dr. Peter Tia dissecting and studying some of these research work before you can start criticizing, or else you really sound sometimes ill-informed, immature. To somebody who's been reading these research papers for years, you just look like you're out of place. Let's listen to one more.
Pretty simple. That's the best things we have for longevity. Taking weird medications that work in fruit flies and may or may not work in humans is not research. That's cosplay. And that's not something you'd want to do or give to people, because that could be dangerous because they haven't been evaluated in those situations. And now CBS News says we are going to leave him on as our contributor. Well, CBS News, you have a person who A, is not board certified, did not pass the basics that are required by most hospitals to practice in them. You have a person who has not shown any clinical research. He has not shown any scientific research. His basis is, trust me, bro, I've done this before, and his recommendations, like eating more protein than anybody else requires or says, is because...
Again, listening to something like this, I could tell that this person, what is his name is, has not listened to Dr. Peter Tia, has not read of his books, and to somebody who has spent a lot of time looking at the work of Dr. Peter Tia, it just sounds really, really ill-informed. So again, what I wanted to stress is, great to criticize him on Epstein emails, but just don't go there. Don't cross a line of now attacking him for some of his longevity positions. I put this shark video in there for a reason that it's sort of like you can poke at the shark from above the pool and just bad behaving shark, hey bad shark, and you could poke at him from above, but then you don't want to jump into the shark pool and try to fight with it with your stick because now you're in the shark's territory, right? You're in the shark's comfort zone and he could really bite you. And that's there's much better ways to go about that. And for example, if you look at the AMA Ask Me Anything episode 30, this is a really good episode. And also he also has some blog posts about it and how to read and understand some scientific studies. And he goes into the details of how you can um, understand the credibility of that research and how what you could take from those. And then he uses this logic for all his work on what you can do today so that you could maximize your chances of living until you're 90, 100 and years old and doing what you want to do. Maybe lift up your great grandson's um, uh, bear hug him, or you want to go hiking with your grandson. If you want to be able to do that in your last decade of your life, what can you do today? What 5 levers can you adjust today to maximize your chances? He doesn't. He's not a person who says, "Hey, let's take this drug and you're gonna be okay." That's why I wanted to make this video to explain. That's not where you want to attack him at. So, but there are weird areas that you could criticize Dr. Peter Attia, and I hope this is the part where you might find this video to be helpful. As somebody who's been a student of Dr. Peter Attia and knows a lot, I could almost talk as if I'm Dr. Peter Attia because I've listened to his positions and he's discussed so many times. So where is the points where it is best to actually criticize him? All right, this is my opinion based on my studies, but first one that you might be able to criticize him is on sleep science. Now, one of the 5 dials, what you can do today to maximize your chances for longevity, one of them is sleep and rest. But a lot of Dr. Peter Attia's work or his position relies on Matthew Walker's positions. He's had Matthew Walker, professor, on his show many times. And for those of you who don't know, Professor Walker wrote a best-selling book called Why We Sleep. And a lot of I've read this book as well. And when I read this kind of book, I don't just read it. I actually look at the references. When Dr. Walker makes a claim, and he has a tag that says, okay, based on this research, I actually read the research. In many cases in his book, I felt like, really? Is this that credible? Does this research really indicate what Dr. Walker is claiming? For example, like increases your immune system so that it fights cancer better. Really? Is it that clear? Like a lot of the claims he make, I felt that the reference research was very weak. So, and I'm not the first person to criticize Dr. Walker on this. There's been many people who've criticized him on his research. But perhaps because of Dr. Peter Attia's relationship with Dr. Walker, he continues to rely on his research. So this is where you could really attack him a little bit. Second place you might be able to criticize him is on statins. Now, you have to be careful here. You don't want to go toe-to-toe talking about whether or not having a high LDL-C or LDL-P cholesterol numbers, having that high, you don't want to claim that has nothing to do with cardiovascular diseases, because I've listened to his talks. I think there was like a 3-hour talk, 4 episodes, like many hours going into details of this, and he can really attack you, or he could really battle you on proving or showing that, hey, there's enough credible research that shows that LDL-C high number is really not where you want to be. But where you could possibly critique him is on Well, how do you lower those LDL-C numbers? And Dr. Attia for many times has said that statins is something that he recommends to his patients and others. And if that's the case, that he claims that a lot of the side effects of statins could be minimized and has very little evidence that it could have ties to cognitive issues. However, if that's the case, why isn't Dr. Peter Attia himself taking statins? And I've watched several of his shows where he talks about the medicine he takes, and never once did I hear him say he himself takes statins. And what he takes instead is something that is normal health insurance would not cover. It's quite expensive, probably like several $1,000s per year, like that you until the rest of your life. So it's a very expensive drug. Now, for well-off people like Dr. Peter Attia and his friends, maybe a few $1,000s each year is not a big deal. But I think for a regular person, it's very unpractical drug to go. So I think it's a PK inhibitors. But anyways, so I don't want to get into the nitty gritty of how you would want to attack Dr. Peter Attia on this statins issue. But what I'm pointing out is this is possible place where you could attack him on. The third place I recommend is on J curve of overtraining. He talks about this in Ask Me Anything episode 38. Basically, there are several studies, especially this meta study, showing that, yeah, it shows that when you exercise, it increases your health and it decreases your mortality rate, but up to a point where if you start overtraining beyond this point, actually more training actually increases your mortality rate. So that's the J curve. Now, in Dr. Peter Attia's position is that no, if you look more closer to each of these studies, there are issues with each one, and that the evidence is very weak that there is a J curve. So I actually went into each of these studies that he mentions, and I looked at the numbers and I looked to analyze it, and I actually didn't agree with Dr. Peter Attia on this. I felt that hey, it's quite inconclusive. It's not black and white, but there seems to be something there where maybe not for everybody, but for a certain population of people, that extreme overtraining does lead to more issues, especially with your heart and especially heart rhythm. So now again, I don't want to go into the details of how you would argue against him, but hey, this is a place where I feel that there's some possibility. All right, let's go to number 4. Fourth place where you could possibly critique Dr. Attia's thinking is his reversal on the benefits of fasting. So you could find a lot of information, especially things he talked about, wrote about maybe 5-6 years ago on why fasting is good for your longevity. However, within the last few years, he's made a reversal on this. Now he's saying that the benefits of fasting does not outweigh the risks of losing muscles. So he doesn't say that fasting is now bad for you, but he's saying that by fasting, many people, especially the elderly, would lose lots of muscle mass, and hence you lose some of the benefits of being able to lift yourself off the ground or all these day-to-day activities you want to be doing when you're 89 years old. So that's why he's reversing this position. However, I felt like, hey, well, I also looked into a lot of the research on autophagies, and yes, it's very hard to really say, there is no scientific research that would say that. Oh, by the way, I'm talking only about extended fasting. I'm not talking about like a 16-hour fast or even like 24-hour fast. What I'm talking about is 3, 4, 5-day fast, really long fasting which Dr. Peter Attia has indicated that when you look at the blood markers over the 3 or 4th, 5th day, that those numbers possibly indicate that the autophagy is being activated strongly. But anyhow, it's really hard to measure autophagy, so you could only guess based on these numbers. But when you do these 4 or 5 day fasts, it's really hard. Even if you exercise every day, you lose a little bit of that muscle mass. But my argument is that sure, you might lose a bit of a muscle mass over the 5 days, but when you look at the strength numbers, that is, let's say you could bench press 100 kilograms, but then when you lose a little bit of muscle mass over the 5 days, if you could still bench press 100 kilogram right at the end of your fast, then maybe it's not a bad thing, because the strength numbers is a better indicator of your longevity compared to muscle mass. So this is where argument could be made. And also, this Dr. Peter Attia hasn't said this specifically, but this is my guess, is that I think Dr. Peter Attia still believes in the benefits of autophagy, but he takes rapamycin, which is a drug that normal person like me would be hard to get and would not be taking, and the rapamycin activates autophagy. So maybe he's thinking that he doesn't have to fast rapamycin. By taking rapamycin, it'll do the autophagy benefits anyways, and then he could also continue to get a lot of protein over instead of fasting and build more muscles. I think that's the angle he's taking. All right, next one, number 5. All right, gotcha moment. Okay, so another video or a lot of posting on social media I see is the gotcha moment, right? People look at the Epstein emails and say, 2017 July, Dr. Attia in New York, his son is in a hospital, and yet he doesn't go fly back to California because he wants to stay in New York. Why? And by looking at the emails and dates, you say, gotcha, I see it. He didn't want to go back to California because he was ready to see Epstein. Oh, I gotcha here, all right? But here's a point about this, right? So yeah, there are a lot of posts like this. They're looking at the book Outlive, one of the New York Times bestseller Outlive, and where Dr. Peter Attia talks about this week where he decided to stay in New York rather than flying back to be with his family, and he totally regrets it. So, but a lot of these posts are saying, hey, I was so busy with work that I didn't want to go back. It's making it look like Dr. Peter Attia is making an excuse that, hey, I have important work in New York, that's why I didn't go back. No. But to these posts, what I recommend is read the book. You don't even have to read the entire book. You just have to read the last chapter. And then when you read the last chapter, you realize, oh my God, this Dr. Peter Attia was completely, his mental health went downhill after this incident. That is, he completely regretted his decision, and it does. I think if you read between the lines, there's indication that he really hated himself so much there was a possibility of self-harm. And the friends around him saw this and says, hey, time out, Dr. Peter Attia. We got to take you to clinic immediately. Stop all your work. We're going to put you in this facility, and you're going to have to get your mental health in order. So when you read this story, what are we saying by mentioning it? It's not a gotcha moment. What are we saying? Like saying, oh my God, Dr. Peter Attia, you should have hated yourself more for the decision you made. Is that what we're saying? Like, here's a guy who almost probably self-harmed himself. He was so depressed, but we're saying, hey, you should have been even more depressed about the decision you made. Is that what we're trying to say? So I don't think you want to do this gotcha moment with this part of the information. But I have one more best angle. This, of all the angles to criticize Dr. Peter Attia, this last one's probably the final best one. But before I go there, I want to say one thing about especially about that doctor who was criticizing Dr. Attia for not finishing his residency and all that. I think what you need to understand is Dr. Peter Attia's expertise is not on cure or treating people who have a heart disease or have cancer. Those he outsources, or he directs them to the cancer experts and all that. What he's talking about, or what he claims that he's an expert at, is for those people who are healthy now, what can you do today to maximize your chances of being healthy when you're 80, 90 years old? So it's more about preventive medicine rather than reactive medicine. So that's why it doesn't matter that he didn't finish his residency. We're not talking about Dr. Peter Attia being the best person to fight cancer or treat your diseases. So that's the part that you really have to understand in order to criticize Dr. Peter Attia. So anyways, the best angle to criticize Dr. Attia is this: emotional health. Now, he even admits this in his book, Outlive, that up until the last chapter, he was the expert telling us about some of the things he knows. But for the last chapter on emotional health, he says, hey, I'm not an expert. I'm a patient. So he's talking as a patient. So this is where I don't know if the word weakness is right, but he doesn't have all the answers that he might have on other parts of the book. And over the years, what I felt is that Dr. Peter Attia is heavily reliant on psychotherapy. Not saying that psychotherapy is bad, but I think you're limiting yourself on how to address this emotional health. I know that Dr. Peter Attia's longtime friend from his Stanford days is Dr. Paul Conti, and that's why that he has very strong faith on psychotherapy. However, I feel like if there's one area that I've studied more or practiced more, is the emotional health aspect of longevity, that I dug a lot deeper and spent a lot more time compared to Dr. Peter Attia on how we could address this issue. And what it led me into is that there's a lot of really, really brilliant people 2,000, 3,000 years ago that we could really learn from. And when we get here, we might call some of these teachings spiritual disciplines or religious traditions, but just because we frame them as religious traditions, I think we're losing out if we're not paying close attention to how these teachings could help our emotional health. Just an example, for example, is Jesus' teaching on Lord's Prayer, right? And one of the verses in Lord's Prayer is, forgive us our trespasses as we forgive those who trespass against us. Now, just saying just that verse 10 times each day, forgive us our trespasses as we will forgive those who trespass against us. Saying that 10 times a day could really help you with your mental stress or emotional health. And just to close this video, just sticking to this Jesus' teaching, another one that I felt was very beneficial is on John 7. This is a story about a woman who was caught in adultery. This is the part where Jesus is in town somewhere, and this lady's been accused of adultery, and these townspeople are getting ready to stone her. And I think it was the Pharisees, one of the religious leader, would come up to Jesus to test Jesus, saying, "Ha, I'm going to get Jesus," because Jesus can't say you shouldn't follow the rules of the Hebrew Bible. However, he cannot. So, anyways, so Jesus, when the Pharisee asked Jesus, "Hey, what should we do, Jesus? What should we do with this woman who had an adultery? Should we stone her?" And Jesus responded, "All right, let's stone her. But let the one who has never sinned throw the first stone." Yeah, if you've never read this story, I recommend that you do that, because that really help you in creating some of these videos to expose Dr. Peter Attia. So I hope this was helpful, and I'm Tomo, and thank you for staying until the end.